So how is the research of our research group and research master embedded in the primary research domains of the university? So as you can see, the research of the gerontological sciences is embedded in the cluster, the cycle of life. So we have a specific research group, the Frailty and Aging Research Group. We are funded by the university by means of an interdisciplinary research program, which is focused on the predictors of frailty in people aged 80 and over. We also receive funding from strategic research program, growth funding by university, focused on a program on entangling the effects of physical exercise to counteract inflammation in aging. Also, we are the founding member of the University Medical Campus Research Cluster Development, Aging and Pathology. There is an alliance research group with University of Ghent and also an international joint research group, Move in Age, with University Groningen and the University of Applied Sciences, Hanze University, also in Groningen. The focus of the research lines of our research group include, on the one hand, the biogerontological and biomedical aspects, and on the other hand, neurocognitive and psychosocial aspects. The biogerontological and biomedical research line is focused on the skeletal muscle and inflammation as key elements in frailty. More particularly, we focus on the triad sarcopenia, dynapenia, and inflammation, including studies investigating the identification and assessment of these aspects, the underlying mechanisms, and intervention studies. For the neurocognitive and psychosocial research line, dementia and Alzheimer's disease are a particular focus, but also motivators and barriers, for instance, for physical activity in elderly persons, are being studied. And of course, how to implement active aging in different contexts. The aim is to set up large research studies where both domains can interact with each other. Our research is typically translational, which means from bed to bedside and in both directions. The fundamental research studies include both in vivo and in vitro experiments, so both on the organismal level as on the cellular level. An important aspect that we investigate is inflammaging, age-related chronic low-grade inflammation and its consequences, and its biomarkers. We also investigate cytoprotective mechanisms, and more particularly the role of Hedgehog proteins, as well as glycation and advanced glycation end products. Finally, immunosenescence, and more particularly immunosenescence in the adaptive immune system, is a particular focus. Clinical research studies are focused, on the one hand, on the development and validation of diagnostic tools, but also on prospective cohort studies, investigating how and which aspects or factors lead, for instance, to frailty. Finally, we conduct randomized controlled trials in order to test the effectiveness of different approaches in order to boost the intrinsic capacity of an individual and to maintain the level of healthy aging. This translational research needs an interdisciplinary team. By clicking on the following link, you can find a most up-to-date description of the composition of our research team. More particularly, the team includes medical and paramedical expertise, including medical doctors and geriatricians, physiotherapists, occupational therapists, and speech therapists. We also have psychologists, social scientists, nurses, masters in physical education, biologists, and biomedical scientists. By means of this interdisciplinary composition of a team, we are able to conduct our translational research focusing on all different aspects of frailty. During your master degree, your research master degree here at this university, you will be embedded, completely integrated in our research team, in this interdisciplinary research team. Importantly is that you identify your topic and corresponding promoter for this journey of 2 years. And so ideally, the topic that you will identify in the coming weeks will be the topic for the next years that you will elaborate. We propose different topics that are provided by the educational and research team. These include the major research lines of our research group. Doing so, this will provide sufficient research capacity and resources for you to conduct your study. Also, it guarantees an intensive research internship by means of hopping on a train which is running towards a specific aim or a specific research program. These proposed topics will enhance the chances for a successful systematic review and also a high-quality PhD fellow application. Importantly, your activities within the research group will enable you to write also an original research paper as master thesis manuscript. We will organize a Meet Your Promoter event. This event is intended to allow the students to interact with the promoters and to explore the possibilities to take part in their research lines and their research topics. Shortly after the Meet Your Promoter event, you will have to confirm your choice of promoter and topic, and you will have to confirm your choice by making use of a standard form signed as well by you as student as by your promoter.